Hello everyone, I'm Dr. Rohan Khandelwal, your Marrow SS General Surgery faculty. And it's always a pleasure to see undergraduates who've been associated with you now doing well in the MCH entrance exams as well. And heartiest congratulations to Dr. Abhishak Kotwal, who secured rank 4 in the recently conducted AIIMS SS exam, where he's got a rank in the trauma and the critical care surgery division. Heartiest congratulations from the entire Marrow team, Dr. Abhishak.
Thank you so much, sir. Thank you.
So, Dr. Abhishek, you've been a student of GMC Jammu all throughout from undergraduation to post graduation, and since the last 2 months, you were working at AIIMS Trauma Center in Delhi. So, please tell us about your journey and your journey with Maro since second year of your post graduation.
Sir, first of all, I would like to tell you I belong to Jammu and Kashmir. जम्मू से 200 किलोमीटर दूर एक टाउन पड़ता है भदरवा. I belong to there, sir. Bhadrava is also called as mini Kashmir, sir. It's very beautiful place. So I have done my, I have been there till 12th, till 12th center tak I was there only. Then I cracked this NEET entrance exam. Then I joined GMC Jammu for my MBBS. So I did my internship from there only. Then I completed my internship in the year of 2019 only. उसके बाद sir, in my first attempt, I cracked this NEET PG surgery specialty, sir. I always wanted to be a surgeon before I joined my MBBS. So it was also a dream come true. I got selected in surgery branch. And GMC Jammu का जो workload है and जो patient load है, it is very much, sir, because GMC Jammu is catering to 10 districts, sir. So it was a great opportunity to me कि I had to work there because patient load was there only. बहुत अच्छा patient load था. A variety of cases we have seen from trauma to general surgery to specialties. So it was like a dream come true that I have been selected in GMC Jammu for my post graduation. So during my post graduation in the first year, we have to do the ward work which we did. So during the second year of my post graduation, I this purchased this Maro subscription. Before that, during my MBBS, मैंने कभी Maro से पढ़ा नहीं था. But my friends always used to tell me, Rohan Khandelwal sir, surgery is just awesome. And I have seen your notes. I have seen your video, one or two videos during my final year MBBS, sir. बट मैं फॉलो नहीं कर पाया जो आपकी वीडियोस थी. तो आई ऑलवेज वांटेड कि दिस ड्यूरिंग माय पोस्ट ग्रेजुएशन आई हैव टू सी योर वीडियोस, सर. सो आई परचेज दिस मैरो सब्सक्रिप्शन एंड इनिशियली बहुत अच्छे से मैंने देखा आपका सारा वीडियोस वगैरह. एंड आई जस्ट वांट टू टेल यू वन थिंग, सर. जिस तरीके से आप पढ़ाते हैं, जो कामनेस है आपकी, सर, जो नॉलेज है आपका, सर, इट इज जस्ट फिनोमिनल, सर. ऐसा मैंने आज तक कभी देखा नहीं है. तो मैंने तो पूरा सेकंड ईयर में जितना भी टाइम मिल पाया, बिकॉज वर्कलोड इन जीएमसी जम्मू इज वेरी मच, सो यू गेट अ वेरी लिटिल टाइम टू स्टडी इन द सेकंड ईयर, सर. तो जितना भी टाइम मिल पाया उसमें मैंने आपकी जनरल सर्जरीज की वीडियोस देखी, सर. तो वो सब कुछ करने के बाद मुझे बेली पढ़ने की नीड नहीं पड़ी, सर. टू बी वेरी फ्रैंक, जितना आपने जनरल सर्जरी पढ़ाया था, बेली आपने ज्यादा ही पढ़ाया था बेली से, सर. तो मेरे को बेली पढ़ने की भी जरूरत नहीं पड़ी, सर, ड्यूरिंग माई सेकंड ईयर पोस्ट ग्रेजुएशन. तो थर्ड ईयर में आते आते सर वर्क थोड़ा सा कम हो जाता है, तो आपको पढ़ने का ज्यादा चांस मिलता है. सो ट्रॉमा की तरफ इंक्लिनेशन सर सेकंड ईयर से ही हो चुका था कि जीएमसी जम्मू इज केटरिंग टू 10 डिस्ट्रिक्ट्स. तो ट्रॉमा बहुत ज्यादा आ रहा है वहां पे, फ्रॉम माइनर एब्रेजन्स टू हेड इंजरीज टू चेस्ट थोरेसिक इंजरीज टू एब्डोमेन इंजरीज. तो उस पॉइंट पे मेरा इंक्लिनेशन हुआ कि ट्रॉमा इज लाइक समथिंग जिसका बर्डन बहुत ज्यादा है, बट कोई डेफिनेट मैनेजमेंट हम नहीं दे पा रहे. कोई एक डेफिनेट सेंटर हमारे पास नहीं है. वी हैव न्यूरो सर्जरी, वी हैव प्लास्टिक सर्जरी. तो उस टाइम पे मुझे कंसेप्ट नहीं था कि ट्रॉमा सर्जरी इज आल्सो देयर, सर. तो उस टाइम पे फिर मैंने सर्च किया. देन आई गॉट टू नो देयर इज अ एमसीएच कोर्स हैपनिंग इन एम्स, सर. तो इस तरीके से मेरा इंक्लिनेशन हुआ टुवर्ड्स ट्रॉमा. एंड आपकी जो ट्रॉमा वीडियोस थी, सर, उनके थ्रू पेशेंट मैनेजमेंट में भी बहुत हेल्प मिला है, सर. तो उसके बाद जब मेरा थर्ड ईयर एंड तक आता गया, तो आई बिकेम क्वाइट श्योर दैट आई वांटेड टू बी अ ट्रॉमा सर्जन ओनली. तो उसके बाद एंड आई जस्ट टोल्ड यू आई वांटेड टू बी अ ट्रॉमा सर्जन बिकॉज द रिजल्ट्स आर वेरी क्विक, सर. विद इन अ वीक यू आर डिस्चार्जिंग अ पेशेंट एंड द पेशेंट इज ओके. If there are no SSIs, so patient is okay, and the attendants of the patient are very thankful to you. you are able to deliver the results very quickly, sir. Very quickly you are able to deliver the results rather than other branches जहाँ पे फिर थोड़ा सा टाइम लग जाता है, like a month or so. So इस तरीके से मेरा inclination हुआ toward trauma surgery, sir. And then after my results, which came in July 2023, I gave this entrance exam for non-MCH senior residency in AIIMS, sir, for which I got selected. I cracked the interview also, sir. Then I had the opportunity to work there for 2.5 months, sir, in the trauma center, AIIMS, sir. So I worked there. I just wanted to see whether I just love trauma or I'm made for trauma, because the working hours are like the post graduation only for 34 hours, 36 hours. You have to be there in your senior residency. I just wanted to see ki, like if I'm able to cope with that situation or not, or if I'm able to take quick decisions which can change the which can literally become life and death for the patient. And I just realized that yes, I can do it. So now I want to pursue my career as trauma surgeon.
So that's great. You've shared your inspiration for becoming a trauma surgeon. Now, this is a branch which not a lot of students take up, right? So, if somebody is interested in trauma surgery, Dr. Abhishek, what additional preparation would you recommend for these candidates?
Sir, I would just like to tell them that first of all, during their post graduation days, they should go for the ATLS course, sir, which is very important for the post graduation, as well as if they want to become a trauma surgeon, because there they teach.
And I think so. It should be made mandatory for all surgery
Mandatory,
postgraduates.
it should be made mandatory to all the surgery residents, sir. So apart from this ATLS course, they should begin their preparation during the second year of their residency. उसके अलावा they can read Bailey, Sebastian, जिसमें trauma बहुत अच्छे से दिया हुआ है, sir. I have just read Bailey, Sebastian and your video, sir, and that was completely enough for me to secure rank 4, sir.
So you would say if somebody wants to go into trauma MCH, they want to prepare for that. What you recommend is the ATLS course, Bailey, Sebastian, and the videos. That should be more than enough.
More than enough to crack the
More than
to crack this
per-
MCH.
perfect. So Dr. Abhishek, you had Maro SS for 2 years. Did you watch other specialty videos as well? If yes, any particular faculty whom you would like to mention?
Sir, I watched the videos for gastrosurgery during my post graduation days, because a little bit inclination was towards the gastro also, sir. Because my guide, मेरे जो guide थे और जो assistant professors थे, they used to perform liver surgeries on CBD. तो वो नॉलेज लेने के लिए मैंने जो गैस्ट्रो फैकल्टी थी, गैस्ट्रो सर्जरी की फैकल्टी, उनका वीडियो देखा सर, एंड इट वाज लिटरली मोर देन इनफ, सर.
Okay. What about the Q bank? Did you solve the Marrow SS Q bank, and do you think that helped you in your
Definitely, sir.
preparation as
Definitely,
well?
sir. For to crack any entrance exam, sir, Q bank, mock test, and revisions. These three are the gold standard, sir. Q bank, mock test series or the grand tests, and the revisions, sir. They are mandatory. Without these, you just cannot crack any entrance exam, sir.
And what ranks were you getting in the mock test or the grand test when you were doing it in the
Sir,
Marrow app?
I was getting quite a good rank later on during my third year residency. Initially, I used to get ranks in thousands only, but when I started to prepare seriously, then my rank was initially 900, then it came down to last, which I remember, was around 60 or 70, sir.
Great. So I mean, consistent, improvement is what you're
It
looking
was
for, and if
consistent
you
improvement.
keep on revising, I think so you will get consistent improvement.
Definitely.
So, Dr. Abhishek, I want to deep dive into trauma surgery only, and once you crack the first step and you're called for the interview, what should a candidate prepare for the Viva part in trauma surgery, trauma and critical care?
First of all, they will take your basic introduction. They will, the first question they will ask is, why do you want to join trauma surgery as a career option? Because as you said, sir, not a lot of candidates are interested. Not a lot of candidates, they go for this trauma surgery, as it is very hectic, sir. Lifelong, you have to be in emergencies also. So it is quite a demanding branch. So the first question they will ask is why do you want to take trauma surgery, sir? एंड इसका अगर सच में जवाब देंगे तो डिफिकल्टी नहीं आएगा डिपार्टमेंटल असेसमेंट क्लियर करने में, बिकॉज दोज फैकल्टी वर देयर सिंस 2008 सर. दे जस्ट नो कि कौन किस रीजन की वजह से वहां पे आ रहा है सर. तो फर्स्ट ऑफ ऑल यू हैव टू बी वेरी थॉरो, यू हैव टू बी वेरी श्योर दैट यू वांट टू बिकम अ ट्रॉमा सर्जन. इफ यू आर नॉट श्योर, अगर आपको हल्का सा भी लाइक डाउट है कि इफ यू वांट टू जॉइन ट्रॉमा सर्जरी और नॉट, जस्ट जॉइन द रेजिडेंसी, सीनियर रेजिडेंसी फर्स्ट, नॉन एमसी सीनियर रेजिडेंसी फर्स्ट, क्लियर योर डाउट. बिकॉज इफ यू जॉइन ट्रॉमा सर्जरी एंड उसके बाद यू आर कमिंग doubts whether I should be here or not, then your life is going to be very hectic, and no more than a hell, sir. So that was the reason ki I joined SR-ship in trauma surgery from AIIMS only, sir. So the second thing they are going to ask you is about the ATLS protocol, sir. Like ATLS course किया है कि नहीं किया है. They will ask you the basics of ATLS. They are going to ask you the ABCD of the ATLS and as well as C ABCDE of the ATLS, sir. Then definitely they are going to give you the scenarios. Like you are posted in the emergency department of trauma center. You are all alone there. A patient is coming. Suppose a patient two-wheeler versus four-wheeler. Then he's coming to you. He's drowsy. His BP is like 90 by 60 or 80 by 60. His pulse rate is 150. What will be your next step? So they just want to see whether you are going in a systemic way as described in ATLS, or you will go just haphazardly, like you will check the GCS, you will check the two cannulas. So they just want to check the, are you going systematically or not, sir? So they will give you case scenarios.
So I have two questions here, Abhishek. Did your experience in AIIMS Delhi, working there for 2 months, help you in this Viva? Because you knew the protocols, you knew about ATLS.
Sir, actually, I have started to read ATLS protocol during my second year of post graduation, sir. So the patients which we were managing in GMC Jammu was according to ATLS protocol only, sir. So I have been exposed to this trauma since my second year residency, and same thing was happening in AIIMS, but in a more well-defined way, in a more systemic way, sir. In a more defined way, what I want to say. So definitely the experience in AIIMS as well as GMC Jammu played a very good role in the departmental assessment, sir. They don't want to check your knowledge. The knowledge has been checked in your MCQs. They check how are you going to like what will be your next step. Like a patient is coming, what is going to be your next step? Because that is going to decide the fate of the patient, whether he's going to die or he's going to survive. It is depending on you only, sir. That one decision, and literally it is happening on daily basis in trauma centers. Like patients are coming there as non-responders, and within 5 minutes of their arrival, once he is declared as non-responder, within 5 to 10 minutes he is in the OT, sir. And I have never seen a person dying there during my these 2.5 months. During these 2.5 months, because of the intervention radiology, intervention radiology, all the seniors, all the quick responses, everyone there know their roles.
That's great. So that brings me to my next question. You know, a lot of postgraduates would be watching this interview and they would want to know what is the scope or what is the future of trauma surgery. So I'm sure you would have also found that out before you entered. So what will be the avenues once you finish this MCH?
So, first of all, there is a misconception that ट्रॉमा सर्जरी करने के बाद देर इज नो स्कोप कि लाइक कोई फ्यूचर नहीं होगा, ट्रॉमा सेंटर्स तो इंडिया में है ही नहीं, तो व्हाट वी आर गोइंग टू डू. बट आई वुड लाइक टू टेल देम, सर, वन थिंग. आफ्टर योर MCH, if you are good enough, you are confident enough, there are more than 9 AIIMS, sir. You can get absorbed in any of the central institutes, because there they have their own trauma centers, sir. As well as there is no saturation in this branch as of now, because this MCH course has started in the year of 2016, sir. So there is no saturation in this branch. So I have never seen any of my senior who is just working as a general surgeon, They all are working as a trauma surgeon. Like in AIIMS Vijaypur, we have one senior here. He's working as a trauma surgeon. He's establishing the department. Then we have all other center institutes, sir. There they can go, as well as you can join the medical colleges also, sir, as a trauma faculty. So I don't see any point कि जहाँ पे लोग बोलते हैं कि there is no scope or no future. And if they are like if they want to go abroad, then there is all new see out there for them.
So I think so. The biggest factor here is motivation. One should be very clear, and they should be motivated to do this branch. And there are enough avenues once you finish your MCH.
Exactly, exactly, sir.
Great. So thank you very much, Dr. Abhishek, for sparing time and talking to us. And I think so your interview would inspire a lot of other postgraduates to consider this as a career option. And once again, heartiest congratulations from the side in the entire Maro team. Any final message to postgraduates who are listening to this interview?
I just want to tell them one thing. Definitely, you have chosen surgery as your career option. Definitely, it's going to be hectic. But you have to spare some time for your studies also, for your life also. You just don't have to work, 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 and work. You just have to balance your life between work and all the things which you love. You just don't want to do only the work, 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 and work, sir.
Perfect. Perfect. Thank you very much, Dr. Abhishek. It was a pleasure talking to you. Thank you.
Thank you, sir.